Doctors continue to treat patients for the coronavirus, but according to a new report, 73% of doctors reported not being able to test patients quickly and easily. Dr. Peter Alperin is a board-certified internist at the San Francisco VA. Dr. Alperin, thanks so much for joining us. COVID-19 numbers are increasing here in the Bay Area. Do you see yourself or other doctors at the VA having a hard time the way the report is suggesting?
So testing has been limited really to patients who are going to be admitted to the hospital. So the ability to do widespread testing so that we can truly understand the prevalence of the disease and how it's truly passing through the community is severely limited.
And when you say widespread testing, do you just mean the availability of tests, or is it a certain test that's more comprehensive?
No, it's the ability to use the existing tests and be able to test all the people that you would want to typically be able to in order to do a proper analysis and understanding of the spread of the disease.
Now, what symptoms need to be present to, I guess, be considered eligible to take the test, or I guess to be sent to the hospital in order to take the test?
So the symptoms of the COVID-19 pneumonia are, a cough and a fever, and shortness of breath can be if it's in a more severe case. So typically, what you really want to be looking for into going to the hospital is when you're having trouble breathing, you're having chest pain, or other symptoms which would not be manageable at home that might indicate that you have a more severe case of the disease.
And for those people that, display certain symptoms, but I guess aren't considered eligible for the testing, I can imagine that interferes with the state's ability to, I guess, report accurate numbers. Because let's say a person does have those symptoms, but they're not able to get a test. We don't know if they're, could test positive for coronavirus or not. But if they were to test positive, that's obviously skewing the numbers to some degree, right?
No, absolutely. You bring up a really good point, which is that for any individual person, the treatment of COVID-19 pneumonia caused by COVID-19 for mild to moderate cases is really to treat yourself symptomatically, to be able to rest and the like, and stay hydrated at your home and quarantine yourself, which is of course critical. But the ability, because we're not able to test all people who potentially have COVID-19, our understanding of the true, what we would say the denominator, so how many people actually have this illness and are infected, is severely limited. So what we have a harder time understanding is the number of people who may have asymptomatic illness. We have estimates from studies that have been done in China, as well as other experiences and our own developing experience. But the reality is that without widespread testing, we would not be able to understand the true prevalence of that disease among all people, both severely symptomatic and not severely symptomatic.
Now, I know coronavirus is unprecedented in the sense that, I don't think we've necessarily seen a virus spread at the rate at which it's spreading and impacting the world the way it's impacted. Has any other, I guess, previous virus or previous condition, has anything else happened in the history of, I guess, humans, or the history of being able to record it, that we saw a shortage of testing like we do now?
I think this is relatively unprecedented. I don't know that I would know enough to say in the history of all of communicable diseases. We certainly have had widespread pandemics before. Everyone talks about the Spanish flu epidemic of 1918. There was the MERS and the SARS epidemics of 15 or 20 years ago. But the ability for us to be able to ramp up the testing has been a significant limitation, and it remains to be, and still remains as one.
And I know you mentioned asymptomatic patients, or people that don't necessarily display symptoms. I know that we were reading that some of the key symptoms, or some of the key things that asymptomatic patients would be experiencing, is loss of taste, loss of smell. I read that pink eye could be one of them. If anyone is displaying these symptoms, I guess, you just recommend that they stay home and kind of just stay away from everyone else to prevent spread if they are, in fact, coronavirus positive, right?
Absolutely. So even if you don't know, you're not able to test yourself, and so you don't know if you're coronavirus positive, which would actually be the more likely scenario because of the lack of testing. Yes, you should quarantine yourself. Some of those symptoms that you describe are absolutely ones to look out for, but you never truly know until you've been tested. But the smart thing to do is to quarantine yourself, take care of yourself, and then call your healthcare provider if you have a primary care physician. Call that doctor, let them know so that they can follow up on you and pay close attention to the development of your symptoms, because the course of the illness can be anywhere from 7 to 14 days. So it's important to stay in touch with your healthcare provider.
And Dr. Alperin, how are things for you and other medical professionals over at the VA in terms of PPE and just kind of being on the front lines with all of this?
Yeah, so personal protective equipment remains an issue, and in fact, it's probably the biggest issue that we have is getting the proper amount of protective equipment for the healthcare workers who are coming into work every day. In fact, I think there was a recent study which looked at this particular issue from some Harvard researchers done in conjunction with an organization called Doximity, which stated that 2/3 of all physicians feel that there's not enough personal protective equipment that's available to them to properly do their jobs.
Well, we really, really appreciate everything that you do, everything that all the doctors are doing, and we really hope that you stay safe and healthy. Dr. Alperin, is there anything else that you think our viewers should know with regard to the condition, the situation as it is right now?
No, I mean, I think it's just to continue to reiterate what it is that we all know: wash your hands, keep your social distancing, and we'll all make it through this together.
All right, Dr. Alperin, we really appreciate your time. Thanks so much for joining us.
Thank you for having me.
Now that's it for this edition of Coronavirus Facts Not Fear. Make sure to tune in every day this week to get the latest information as we sift through the facts and fiction of the coronavirus. I'm Sanaz Tahernia. Thanks for joining us.